only other thing, Ms. Patel, I think you would benefit from that I'm going to give you in your goodie bag is an end-tuft brush. It's kind of a chopped off little toothbrush. It's like a quarter toothbrush. And I think you would benefit back in the last molars back here because you had some plaque back in there. And if you'll utilize this little brush, again, just like I'm telling you to use your toothbrush, if you'll get it back there on that last tooth and really work the bristles down up under the gum line, it's like a mini toothbrush. And then I noticed that you have some area of buildup down here. You can actually use this little toothbrush down in those areas where you get kind of more to build up. And again, use it like a little electric toothbrush. But this is called an end-tuft brush, and you can buy these at CVS, Walmart, Eckerd's, Walgreens, and they're wonderful little brushes. I like to use mine while I'm sitting there watching television at night, and I just like to stimulate my gums and just work my gum line and just kind of stir those germs up. Okay, the more you can get in there and stir the germs up, the less damage that they can do. So I'm going to give you this in your goodie bag and utilize this too. It's called an end-tuft brush. Okay. The last thing I want to recommend is a toothpaste. What kind of toothpaste are you using?
Crest Pro Health.
Okay, Crest Pro Health is an awesome one. Matter of fact, I have Crest Pro Health here. It does a lot to help with decay, gingivitis, help control the plaque level, also with sensitivity. It's got an ingredient in there. You'll notice that, do you notice that it's a
little rough.
Rough, okay. Make sure when you use the Crest Pro Health, you run water over it, okay? But the biggest thing is that you want a toothpaste recommended by, you see this little seal here? Mm-hmm. It says ADA. It's the ADA seal of approval, the American Dental Association seal. Basically, all of them are good, but just look for that little seal of approval because that just says that they tested this toothpaste and it's a good one, and it's a good one for you to use. So really, we don't really recommend one or the other, but Crest Pro Health is a good one. Colgate Total is another good one. If you have sensitivity to like hots and colds, or colds mainly, you can use some sensitive toothpaste. This one's put out by Colgate, and it's Enamel Protect. So anything that's, like I said, you look for that seal, that ADA seal of approval, and so all the brand names usually are the ADA seal of approval. A lot of your sensitivity toothpaste have the potassium nitrate. That's the main ingredient in the toothpaste, potassium nitrate, which this one says 5%. Okay, and most of your toothpastes do have your sodium fluoride in it. Mm-hmm. And this Crest Pro Health actually has stannous fluoride in it. And this is the first toothpaste that they've been able to make that has the stannous that's really done some good beneficial things for patients. So what you're using is great. But basically, just look for that ADA seal of approval. Okay? Thank you. You've been a wonderful patient. I hope you learned a lot, and I'll send you home with some literature because I know I explained a lot to you. Mm-hmm. And if you have any questions, just feel free to call me, and I'll be happy to answer. Okay. But I'm looking forward to working with you today.
All right, thank you.
Thank you.